stridor is a high-pitched sound caused by narrowed airways, and it can tell us a lot about where the problem lies. Inspiratory stridor occurs when breathing in and suggests a blockage in the upper airway, like the supraglottis or glottis. This can be seen in conditions like epiglottitis or laryngomalacia. It often comes with a hoarse voice and needs immediate attention, especially if the airway is swollen. Biphasic stridor happens during both inhalation and exhalation, pointing to a fixed obstruction in the subglottic area or upper trachea. This might be due to conditions like croup or subglottic stenosis. It's a red flag for more serious airway narrowing and often requires further investigation. Expiratory stridor shows up when breathing out and usually indicates an issue in the lower trachea or bronchi, like tracheomalacia. This condition can cause the airways to collapse during exhalation, making it difficult to breathe out fully and clear secretions. Recognizing these types of stridor helps determine the location of the problem and the urgency of care. It's a critical skill for managing airway emergencies effectively.